I think I accidentally muted myself. Can you hear me now?
Okay, yes, we can hear you.
Oh, perfect. Hi, everyone. Thanks, Linda. I'm Jonathan. We're about to get started. This is our webinar. It is called What Every Health Educator Needs to Know About ALICE Populations, Asset Limited, Income, and Strand Employed. In a moment, I'll hand over the reins to our speaker, Ashley Anglin. So Dr. Ashley Anglin is a community and cultural psychologist with a PhD from the University of Hawaii. She also holds graduate certificates in public policy and executive philanthropy. Dr. Anglin directs the production process for United, for ALICE, and provides support to the research, editing, and design teams. Her aim is to ensure that the reports are accurate, engaging, accessible, and lead to action that helps ALICE. Before joining the United Way, she worked in community engagement and health improvement for a large health system and has been involved in community development and community organizing efforts in several states. So everyone, just please remember to mute your microphones, and any questions that you may have, please put in the chat box and we'll get to those at the end of the webinar. So Ashley, I'm going to hand it on over to you.
Okay, great. Thanks so much. Can you all hear me?
Yep, we can hear you, Ashley.
I think we can.
All right, perfect. Thanks so much for the introduction, Jonathan. And as he mentioned, there's a comment or a chat feature. So I'm going to do my best as I go through to keep an eye on that. So if you do have questions, especially if it relates to a specific slide or a piece of data that we're looking at, feel free to jump in. I'll do my best to answer those as we go. But please know at the end, we will let everyone unmute and we can have some conversation around some of the things that we've talked about together today. So hopefully a little bit of both, but please, you know, I don't want to just monologue, so I'm happy to answer questions as I go, and there will be time for that as well. So feel free to jump in that way if you need to. And yeah, great. So really happy to be joining you all today. As Jonathan mentioned, I've worked in kind of the health field for several years before joining United for ALICE, and so it's really great to reconnect with this population of health educators and public health professionals, and to tell you a little more about ALICE and what the work we're doing through the United Way of Northern New Jersey, both in the state and nationwide. Let's see here. So to give you a sense of what we're going to talk about today, we're going to cover just a brief introduction to United for ALICE. Some of you on the phone might already know about ALICE, might have already worked with this data, or it might be completely new to you. So I'm just going to assume that you need a little bit of background, and I'll tell you a little bit more about that project. You might have also heard it referred to as United Way ALICE Project. We're kind of rebranding now under our new name, so you're one of the first groups that gets to hear that kind of new brand, that United for ALICE, which we're excited to be sharing. I'll then talk about ALICE in New Jersey specifically, and I'll include a web tour so that hopefully by the time you leave this webinar, you'll be able to access the data yourself, explore it, dig deeper, and find out exactly what you need to use in your own area of interest. So we'll learn about what resources are available to you outside of this webinar as well. We're going to dig a little bit into the topic of ALICE and health, including some key indicators that we know are related and that we see strong relationships with when we look at ALICE throughout the state and other areas in the country. And then we're going to talk a little bit together about using ALICE to inform health initiatives. So I'll give you some ideas and ways I've seen ALICE data used in the health profession, but I also want to hear from you, what sparks your interest? How do you think you could apply this data? Because really the goal is this is data that's meant for action. It's not meant to sit on a shelf. It's meant to be something that you can take and apply in your community and hopefully help you better do the wonderful jobs that you're already doing in terms of improving health in your area. So we'll talk a little bit about that, and I want to get your perspective as well. So ALICE stands for Asset Limited, Income Constrained, Employed. And one of the reasons this project started, it actually started in Morris County, New Jersey, when we were seeing a lot of people needing social services, coming to different programs and social services, but seeing the overall data showing a very small percentage of people in poverty. So there was a mismatch between who we saw in need and who the statistics said were in need. And so we wanted to find a way to look at that a little bit more closely and more thoughtfully, other than just the idea of poverty based on the federal poverty level, which I'll talk about a little bit too. And so this measure is really giving us a sense of what is the minimum household budget necessary to survive in a given geography. And we use counties as our main level of interest. Because we all know county to county, even within counties, there's a lot of variety in what it costs to live, especially in a state like New Jersey. And so this started with that analysis in Morris County, then it spread to northern New Jersey, then all of New Jersey. Fast forward now, 10 years later, and we're in 20 different states. And we're expanding, and we also have national data available on the website. And all of this is really to do a couple of things. We want to use this what we call that household survival budget, so that minimum budget that you need to get by in a place, as a standard measure used to understand who is in need, who is potentially needing different resources, who might be struggling based on their employment or other factors. So we want this to be used, and we'd really like to change the common term from working poor to ALICE, because there's a lot of connotations when people think about the word poor or poverty that might impact the way they treat folks, or the way that they provide services, or the way that they develop their programs. So we think ALICE is as a kind of a new term, something that's a fresh way for folks to understand that in most cases, these are families that are working really hard and still not able to get by in their community. We also want to kind of shift the agenda in public policy from poverty to helping ALICE, and to really recognize the value of all jobs, and really focus on making sure that everyone has a voice in the workplace and flexibility to do their jobs well while still caring for their families and doing all the things that we all do on a daily basis. So what does this budget look like for New Jersey? New Jersey, we all know, is a relatively expensive area, relatively expensive state. And what we look at when we talk about the household survival budget are these different categories that you see here in the budget line. So we look at the cost of housing, childcare, food, transportation, healthcare, technology, miscellaneous, which is just a small 10% of the overall budget, monthly budget, that is for those things that you need for work, like your uniform for work, or gas to get there, or those little things that you need just to get by, and taxes. And we have a monthly total for different family types, and then an annual total, and the wage that's necessary to support that budget. So this is kind of the basis for all the different analyses that we do when we talk about ALICE. And if folks are interested in knowing the methodology behind this and the sources, you can visit our website, and I'll show you where to do that later. We have a methodology section where you can learn more, but if you have questions, I can answer those as well. But we use standard measures that are publicly available, and just the way that we combine them in this unique methodology is what makes the ALICE project special. And so what we found is, for New Jersey, costs are increasing, and what we see is about an hourly wage of about $13.82 needed for a single adult minimum, but for a family with kids, that goes up substantially because you're adding the cost of childcare, et cetera. So around $37 for that type of family. We also present this with 6 different budget types or family types. So we all know that these aren't the only types of families that are out there, and I'll show you a little bit about that later. And we see this increasing over time, and it's really the minimum wage for 2016, which is when the data is from, was only $8.38 an hour. So yeah, you see that gap there. You also see a really big difference between what's the actual cost of living and what the federal poverty level considers an adequate wage. So the federal poverty level for 2016 was $11,880 for a single adult, compared to this actual budget of what it costs, which is $26,640. So again, there's a lot of folks who aren't considered to be in poverty based on that federal poverty level, but who are still living paycheck to paycheck. They're not saving, they're not able to really invest in any way, and they're kind of one potential crisis away from falling below that level. So a giant healthcare expense, or the car breaks down, or a family member loses a job. So it's really just on that brink. And so this is what we're trying to bring attention to. Those are the people who are ALICE. And in most of the states that we've been studying, we're seeing that financial hardship increasing over time. Here we have for New Jersey, you can see that dark blue part is the poverty percent, so that's based on the federal poverty level. The kind of lighter blue up there is the ALICE percentage, so those are people that are above the federal poverty level, below that being able to afford that budget. We call that the ALICE threshold. And then you see the rest who are above that ALICE threshold. And in New Jersey, you see that increasing over time. And the total number of households that increased over time went from 10% to 16%. And we're seeing this in most states. And another part that we think is really important about identifying ALICE is that we've all been hearing in the media the fact that, you know, there's the employment rate, or the unemployment rate is going down, so that it sounds like more people are working. There are more jobs overall. And it sounds like, you know, things are trending in the right direction. However, we're still seeing ALICE increase over time. And a big piece of that is that there may be more jobs, but a lot of those jobs, like we'll see, are in the have lower wages. So people are still having to work multiple jobs. They're still not getting by. So they might be working, like most of ALICE is working households, but it's not enough to actually be a living wage. So that's kind of a gap that we're seeing there too. New Jersey has the 38th highest percentage of households with income below the ALICE threshold. New Mexico has the highest, and North Dakota has the lowest. So we do have the national data available on our website too for those who are interested in kind of those comparisons. But you can kind of see that spread here in the map of the country, with the lighter colors being better, so fewer people below the ALICE threshold, and the darker colors being more people below the ALICE threshold, or more households. We also know that ALICE lives in all the counties. So there's a lot of variation here. And I'll show you these drill down options on the website, because we know it's not just counties that vary in terms of who is ALICE. We can also look at the zip code level, county subdivisions, places. And when I do a little bit of a tutorial on the website, I'll show you how you can look up specific zip codes or areas that might be of interest to you. The lesson here is that behind the New Jersey state average, there's a lot of variation among the counties and the percentage of ALICE and poverty level households. So it ranges from 27% of households with, below the ALICE threshold, which is the lowest, that's in Hunterdon County, to 61% in Cumberland County. And, you know, contrary to stereotypes that say that financial hardship only exists in cities, across New Jersey, ALICE families live in every county across rural, urban, suburban areas. So it's not just cities, it's not just really rural, it's really everywhere. Let me go back real quick. And of the New Jersey's largest cities, so the 20 largest cities, every city between 2010 and 2016, except for Clifton and Passaic, experienced an increase in households below the ALICE threshold. And some of those were big jumps. So especially those towns that were hit hardest by Superstorm Sandy. So Toms River had a 66% increase. So that's one of those areas where you see the impact of the environment having, and the importance of, you know, the community resources after times of struggle. ALICE households are also in all age groups. So the way we do the calculation is by the age of the head of household. But what we see is that the number of households overall in New Jersey increased by 1% from 2010 to 2016. But the number of houses below the ALICE threshold increased even more by 15%. So you can see how across almost every single age group, except for those under 25 years, which didn't have a change, all of those other groups increased in terms of the number of households below the ALICE threshold. So particularly those that are 45 to 64 years saw a 22% increase. And that's the place where folks are kind of in their prime working years, top of their, you know, end of their careers or top of their careers. So it's always surprising and kind of disheartening a little to see more people in that range also becoming ALIS. So we know that, you still might be working, but cost of living is increasing, and wages aren't really keeping pace in a lot of cases. So I don't see any comments. Feel free to jump in. I'm still monologue-y, so if you have any questions so far, let me know. Otherwise, we'll just get through this part of the data and then take a little pause. So another place we see variation in ALIS households is when we look at race ethnicity. So from 2010 to 2016, the number of households below the ALIS threshold increased in almost all age and racial ethnic groups. We see the largest increases in Asian and Hispanic senior households. So Asian senior households, the percent below the ALIS threshold increased by 80%, so that was a big jump. Granted, it is a smaller number of households in the state, but still we're seeing that group becoming more likely to be ALIS. Same thing with Hispanic Latino households. For the seniors in that group, the below the ALIS threshold percentage increasing by 53%. A couple groups did see a decrease. So Black under 25-year-old households, but they also experienced a decrease in the total number of households. So these are some of the trends that we're seeing over time. And this trend of more seniors becoming ALIS is unfortunately not unique to New Jersey. And we'll also talk about in a little bit how that population, we all know, is growing in our country, in our state. And so it does have major implications for kind of the resources that we provide those groups to help more from falling below the ALIS threshold. ALIS households also vary by family type. So we look at a bunch of different types of families in terms of our budget, but we also look at comparing single or cohabitating adults with no children under 18, families with children, and those who are 65 plus to see the breakdown of who is ALIS. So what you're seeing in this bar chart is, again, the dark blue poverty, the kind of lighter purplish blue percent ALIS, the lightest kind of gray above the ALIS threshold. And then you can also see in the yellow or gold that those are the total households in thousands for that particular group. And so, there's a lot of these preconceptions about what types of families tend to be low income. We hear a lot about single mothers or, folks that are living in rural areas, but we see these trends across kind of all family types. In New Jersey and in most states we study, households headed by single or cohabitating adults with no children are the most common household type in the state. And in that type of household, 37% are below the ALIS threshold. So a pretty large percentage of the biggest group in terms of family type are ALIS. Families with children, you have about 35% below the ALIS threshold, which is still a big chunk of that family type as well. And it's even more for, like I mentioned, we got 46% for households 65 plus. And we'll talk about some of the factors why seniors are more likely to be ALIS, but a big part of it is healthcare expenses. ALIS families are also changing over time. Of all families with children, 35%, like I mentioned, have that income below the ALIS threshold. And there's differences between single family or single parent households and married parent households as well. So 41% of families below the ALIS threshold were married parent households. 47% of single female-headed households were below the ALIS threshold, and 11% of single male-headed households were below the ALIS threshold. There's definitely fewer single male households in the state, but nonetheless, there is a good portion of those that are below the ALIS threshold. But these types of families overall are actually kind of decreasing. There's fewer of them over time. So fewer families with children, in other words, and more of those single cohabitating adults with no children. People in New Jersey, I just want to point out, we talked a little bit about wages here, but the 51% of all jobs in New Jersey in 2016 paid less than $20 an hour. And we're seeing this slowly change. I know there was recently some legislation for New Jersey in terms of the minimum wage increases that are coming. Definitely will have an impact on the number of people who are ALICE. But, you know, adding jobs, they have to be quality jobs really to help move this measure. So again, for a single adult in 2016 was needing to make $13.82 versus around $8 where it was. And so in comparison, you know, it's getting better. So in comparison, in 2010, 55% of jobs paid less than $20 an hour. So it's going in the right direction. But in every state, you see this kind of distribution. So a lot of jobs less than $20, a decent amount, 20 to 40, and then it really drops off from there. And actually in 2016, only 3 of the top 20 occupations paid enough to support the household survival budget. So that's, I'm gonna say that again because that's a big deal. That's 3 out of the top 20 occupations paid enough to support that budget for a family of 4. So there were some questions too I saw come up. Let me take a minute to pause and look at that because the next thing we're going to do is actually look at the website. So if others have questions, now is a good time to pause and let me read the ones that we have so far. So one person just kind of commenting, I think, to kind of validate this experience was saying within their own peer group, a number of families who have recently experienced unemployment or underemployment in their 40s and 50s. It's a scary time to be ALICE when you also have mortgage payments and children heading to college. That's absolutely true. We do see a lot of that. It makes it harder to have sometimes those bigger expenses that you have at that point in your life. And that's definitely something that we see in a lot of different families and the need to work multiple jobs. We do see, just as an anecdote, in most of the states we study, the percentage of households working those multiple jobs increasing. So it's important to hear that kind of personal experience as well. And then in terms of, there's another question about making ALICE calculations for seniors in terms of employment if many are retired. There are folks in this ALICE group over 65 who are retired. We're not able to really differentiate those retired and working as much. There are some things that we dig into a little bit deeper into the report to kind of give that some context, but there are people who are, we call in this ALICE bucket, that are not actively working or out of the workforce. The vast majority are working, and we are seeing more seniors 65 staying in the workforce than there have been in the past too. And then another question here, is there any consideration for job structure if retirement or other investment in savings or healthcare are included? I would imagine these benefits could probably decrease the household budget or give a better cushion long term. Yeah, so that's a great question. So this budget is meant to be absolutely bare bones. So it does include tax deductions. So based on income, so some of those standard things that you would get in those line items, but there are a lot of other factors that impact ALICE that are not captured in the budget itself. This is meant to be the absolute bare bones. So there are definitely some folks who might have other savings, might have investments or other resources that help keep them afloat, which could improve, or lower the number of ALICE families. But there also are other things that are not directly considered, like debt. So it can go the other way. So this budget is meant to just be kind of the basics, but definitely in terms of discussing how that works, it can go either way if those families have additional resources that are not included or not reported in terms of their taxes. But we do include those tax deductions, and we also include child care deductions based on those budget items. So I'm going to share the website screen now. So hopefully in a second, that's what you'll be seeing. Okay. Maybe if someone can either comment me or thumbs up if you are able to see the website now. Is that what we're seeing?
Yep, you got it switched over, Ashley. You're good to go.
Okay, perfect. So yeah, great questions. Keep them coming. I do want to show you a little bit how you can find some of this data yourself and navigate the website before we talk about some of the health implications. But our main website is unitedforalice.org. I'm going to take you through where to find everything. So we're starting just from the very first page. When you come to the site, there's a lot of things to explore, so feel free to explore things that I'm not sharing here today, but these are the places where you'll be able to find the New Jersey data. So under Research Center, you can go to select state. Like I mentioned, we also have some national comparison data, a place where you can download all the different reports for our different states. But these interactive pages are based on each county, or sorry, each state, and then the counties and sub-counties within it. So you can select which state you're looking at. We're going to obviously talk New Jersey. But if you do have other interests, feel free to explore. So this is the page where we can see, you can download different pieces and parts, and you can also explore our interactive maps and figures. I'm going to take you through just a little bit briefly of what downloads are available. The first one is just the full report. So if you haven't read or accessed the latest New Jersey report, it just launched a couple months ago. It's based on the latest data we have, which is on a lag, so 2016 data, but there is some discussion of how things have changed since then. But that's our latest report. It has a lot of detail about different topics, some of the things that you were all questioning today. It does talk a little bit more about health. So I encourage you to check it out if you're interested in learning more. That's available for download here under latest report. We also have what we call county pages. So I'll show you this here. These county pages basically are a 2-page spread for every county in the state. And it'll show you, these are great because they're really easy to kind of print and share and disseminate. And they're really good kind of starting points for if you're trying to share this data with others or learn more about it yourself. It'll tell you for that county, the population, number of households, median household income, unemployment rate for the county, and then percent ALICE households and percent in poverty compared to some of those state averages. There's a little bit of narrative to kind of guide you through it, but you'll recognize this figure. So this is one we looked at for the whole state that's made now specific for this county. So for this county, the percent poverty, percent ALICE, and percent above the ALICE threshold. Those different household types I showed you again, so families with children, single cohabitating, 65 and over for each of these groups for that county specifically. So that's another way to kind of view the breakdown for that county. There's also a really handy table here that talks about the towns or the places within that county, and it gives you the total households and the percent ALICE and poverty. So that's your below the ALICE threshold percentage total. So that includes the poverty percentage and the ALICE percentage. So for example, for Atlantic City, 77% of households below the ALICE threshold. There's also a budget that's specific to that county. So the one I showed you overall in the slide deck was for New Jersey as a state. This is specifically for the county. And then I didn't include a lot. We have a lot in the report about kind of firm size, employment, some different things. I didn't include those in the overall presentation, but you can definitely dig into them. But what this is showing is private sector employment by firm size. So depending on the size of the organization firm, how much they actually pay in wages. So these are what we call those county pages. And there's, again, 2-page spread for every county in the state. There was also a question too about, have you found that communities in higher need are receptive to this data, particularly on the political and policy side? That's a really great question. In general, most people are pretty receptive to this because it's telling the story that they know is happening in their communities. So the thing we usually see is that people are not agreeing on the number of people who are in poverty based on just the federal poverty level. So they're saying, no, there's much more need here, or they're saying, no, there's not that much need. It's usually something they're feeling isn't inaccurate. So generally people are receptive to this because they feel like it's capturing more of those families that are in need. The higher need areas, depending on the group, I mean, we have had some people who are policymakers who only want to look at the rosy side of things. And when they see this data for their county, they want to hide it a little bit because they're like, no, it's a good place to work and be. And you know, but for the most part, especially with our nonprofit partners and some of, and including politicians and policymakers too, some government folks, they see this as a way to get new resources to their community, to those who need it the most. So there's some receptivity to that as well, yeah. Another thing that I wanted to show, I mentioned this when I was going through the PowerPoint, was that we know there's not just two types of families when it comes to the budget. So the ones that we use the most in the report are the single adult, and then this 2 adults, 1 infant, 1 preschooler. So each kind of the furthest range in this group. But we also have for the state 6 different family types that you can look at the budget, so you can see how that changes based on adding another infant, adding a child, only having 1 adult and 1 infant. And there's actually in the notes section down here, there's actually a way to add additional infants or preschoolers or school-age children to that. So we have that for this, what we call the survival budget. And then we have the stability budget. Just briefly, I do want to mention that we talk about it in the report, but the stability budget is basically a slightly more cushy budget. It's a little bit above the bare bones. It has it's slightly better housing, slightly better childcare, so licensed childcare as opposed to family childcare. It has a savings line, which is not included in the stability budget. So it's still a pretty modest budget, but it's a little bit more padded with that savings, and it's a little bit more comfortable in terms of some of the line items for that budget. So you can look at that for the different groups. And then we have the same thing for every county. So we just looked at Atlantic, so let's get down to we'll talk about, hey, Bergen County, all right. So the same thing here for each county. You can look at the survival budget for 6 different family types. Use this to calculate additional family members, and then also your ALICE household stability budget as well. So this is what we call our budget. So this is a helpful tool, and I'll talk about how people have used this in practice when we talk about some of those implications. We also have a data file. I'm not going to open it, but this is an Excel file that has the raw data for a lot of the things that we are using in our calculations. So if you're a person who likes to be nerdy like me and do some of these calculations and get in there and ask your own questions, do it. This is a great way if you want to combine sub-county geographies. So for example, if you're most interested in 4 zip codes and want to see what the % ALICE poverty and above the ALICE threshold for those 4 zip codes together are, you can use the data file to actually calculate that yourself. So this is where we point those folks who want to get out their calculators. And then we also have a bibliography, and you can click additional materials to see past reports. So those are the downloads that are available, but we also have an interactive map and figure system that I think is fantastic. I love it. It's my favorite. So hopefully if you're one of those people who likes maps and getting to play around with the data yourself, hopefully you also find this enjoyable. And we're looking to do more of this type of thing in the future. But, oh, I just realized I never turned my camera back on. Oh, sorry guys, I was gonna do that. I'll turn it on so you can see me for the last half. Hi. So here we have a map that you can, first of all, you can mouse over it. So you can just kind of move across each county and see different things. So you can say, oh, you know, what do we got going on here for Morris County? You can see those kind of what we call those top line numbers. So those are total households, % poverty, % ALICE, and above the ALICE threshold. It's a really quick way to get that information and use it. So you can kind of see this, but if you want to dig in a little deeper, so say, all right, that's good, I've got the basics. Let's jump into what's the county we haven't talked about yet. Let's click on Union County. Once you select the county, you'll see this other side of the page come to life. So you'll see a drop down also come out that has a couple different things. Place, PUMA, sub-county, and zip code. Just briefly, place is those geographies that you're probably used to hearing about. Those are like our towns and townships and cities. So Summit City, New Providence Borough, Plainfield, Fanwood, Elizabeth City, Linden City. So those are your places. You also can look at PUMA. So PUMAs are interesting. They're usually kind of like development districts. People don't tend to use them. It's a census designated area, but it's meant to cover the entire, it's more like a region within a county. So it's meant to kind of combine a couple areas, and they always have a minimum of 10,000 people in them. So that's a PUMA. Not a lot of people use those, but sub-county is also helpful. It divides the whole county into, it covers the entire county, whereas places, there are some gaps because there's places where they're not a specific city, for example. This includes kind of a combination of that. So this, for New Jersey, this is usually the more comprehensive of the sub-county areas to take a look at. Is the sub-county area, so you can see each little piece of the county covered. Zip code, you know what those are. Folks love these because people do tend to know what their zip codes are, as opposed to knowing their PUMA. So you can take a look at these, and again, mousing over them will show you that those top level numbers. Also, when you have a county selected, you can scroll down and see these charts will populate. So this is the household survival budget for that county. And I'll let you all kind of explore this on your own because there's a lot of information here, but it'll populate these charts with households by income, families with children, households by age, race and ethnicity, and employment by firm size. There's also this chart that you already saw, which talks about jobs statewide. That's the only one that's not a county-specific thing. So you can see how those vary from county to county. But you can also combine geographies. So I want to show you that before we go back to the presentation. Is you can press Control and then click to select multiple areas. And then what that's going to show you below is the average for those areas that you select. So you can play around with it. This is something that's best learned when you can kind of do it on your own. So I won't go too much more into detail here, but if you play around with it and then you end up having questions about how to navigate, please reach out, and I'm happy to show you more about how to do that. But this is where all the data lives for our site. I'm going to go back now, just in the interest of time, to show you a little bit about, let's see, if this will work. A little bit about kind of the connection to health specifically. So we're going to switch back to the PowerPoint. All right, can someone, what are you seeing currently? Are you seeing a PowerPoint slide? Or are you seeing?
Yeah, we got the PowerPoint.
Okay, perfect. So just some emerging trends that we're seeing, and we're just going to focus on health really for this, but we are seeing changes in the household. So we're seeing more seniors, the senior population growing faster than other groups. The report talks a lot about that cost of living for seniors, and the fact that the household survival budget doesn't take into account those different spending patterns for seniors. You know, cost of housing, food, transportation, et cetera. So that's an important thing to look into in the report if you're interested. Also changes in kind of jobs and the structure of jobs. The report goes into that. And then there's also this discussion about growing inequality in health, and how we're seeing that change and become more of a factor in terms of who is Alice. So place impacts health, we know that, and it really matters where Alice lives. A lot of the pieces of the budget have to do with, you know, those things that you have access to in your community. So access to jobs, that contributes to that health wealth gap, access to care, environmental hazards. We talked about the impact of Superstorm Sandy really increasing the percentage of people who are below the Alice threshold in Toms River, for example. Access to childcare, education opportunities, affordable housing, and access to healthy food and exercise. And so what we're seeing is, like, if you look overall across these different indicators, healthy communities mean fewer Alice households. So this link between health, wealth, is really distinct, and we see ALICE related to a lot of these different indicators. So the more barriers you're facing, and this, you see that in that figure there, in terms of poor housing, unemployment, inadequate food, nutrition, getting that care and those health hazards, they pile up on you. It gets harder over time, and we really see that reflected directly in people's budgets too. We also see ALICE informing key health indicators. So we have in our database, we've been starting to do a lot of work around these different indicators related to health outcomes. So insufficient sleep, mental distress. We have many different ones that we actually have mapped right now that we're working on. And what we're seeing is pretty strong correlations in most cases across most counties for this, for these indicators. So I just want to show you really quick what that looks like, and then we'll have a little bit of discussion in open time. So let me go to, there we go. Okay. So you should be seeing here a interactive kind of scatter plot here of a couple different things. So we have, for all the different counties, let me go to New Jersey, because we have this actually for the whole country, if it decides it wants to work. All these different health indicators and all the different counties that we have in our geography. So let me select New Jersey. Okay, here we go. All right, so for New Jersey, we're looking at a bunch of different things, but one of the ones that we see really well correlated is this frequent mental distress or frequent physical distress and the ALICE threshold. So what this line is showing you basically is a correlation between the percent of people who say they frequently have physical distress and the percent of households that are below the ALICE threshold for those counties. And so the this line is, they're all clustering on this line, showing that these things are really related. So the households or communities that have fewer households below the ALICE threshold also have fewer people who have physical health distress. The ones that, like here we have Cumberland County, which has upwards of 60% of people below the ALICE threshold, also has the most people that are reporting physical distress. And we see this across a bunch of different indicators. For example, here's food insecurity. So we're seeing a close relationship between food insecurity and below the ALICE threshold. We're seeing it for, let me see if there's another one just real quick to show you. For age-adjusted mortality and different health-specific health outcomes and different morbidities and mortality. So there's a lot of different things we're kind of looking into, and we can always answer some questions about these too, but here's years of potential life lost being related. So again, ALICE is really tied directly to a lot of these different health indicators. Okay, so this last part, I just wanted to see and get a sense of kind of what your thinking is related to this and open it up for a little bit of discussion. I wanted to share first a little bit about how we've seen ALICE used to inform health initiatives and other initiatives for taking action for ALICE. Just to plant a couple seeds in your mind, but then I really want to have a bit of a conversation if we have the time. So the first way we've seen people really use this data to inform, especially health initiatives, are, first of all, zooming in on target geographies or populations. So often ALICE is what we call a hidden population because it's above that federal poverty level and there was never a name for it. That's a lot of families who were just kind of being left out of the discussion, especially when it came to providing resources and needs. So bringing attention to ALICE in and of itself has helped inform these different health initiatives and programs. Also, the fact that you can track this over time. We update the data every 2 years. And you can see it at the sub-county level. That's been a big thing that people have been using. So in their particular municipality, for example, making the case for resources. People have used this to say, okay, in my municipality, there might be a low poverty percent, but here's all these other ALICE households that we've missed, and been able to get grants and resources to address that population in a new way. People also use it for determining eligibility for programming. So we know that the federal poverty level is really a broken metric, because think about it. Most of us have looked at program eligibility, and we say things like 150% of the federal poverty level, 210% of the federal poverty level. To me, the fact that we're having to kind of make up these arbitrary changes means that something's wrong with that number. It doesn't work for us anymore. And it also it makes the assumption that the cost of living is the same everywhere in the country. It's saying that it's cost the same to live in a suburban New Jersey as it does to live in rural Georgia, where I grew up, which I know is not the case. I've lived in both places, believe me. There's a difference in cost of living. So people use it to adjust, use ALICE for program eligibility. So that's a big one. You can use that budget document that I said to see what cutoffs in that cost of living are needed to be able to be eligible, for example, for a health program or screening. So hopefully that you can expand your services to those who do need it. It also helps to highlight systemic inequality in our communities. The data shows us that households of color are more likely to be ALICE, women are more likely to be ALICE, and that these things are directly connected to the social determinants of health. So those indicators that I showed you are really bringing to light a lot of gaps in health. Those gaps are getting wider, not smaller. As precision medicine or bioengineering increases, so the ability for folks to do these, change their genome and avoid certain diseases or have specific genomic testing done, that stuff's expensive. It's not accessible to everybody. So the people that are living the longest may be living longer, and the people that are struggling may be struggling more without having access to those types of advancements in medicine. So I had another question too. What types of programs and services has this data spurred? Specific examples. For United Way of Northern New Jersey, our focus has really been helping people qualify for services in a new way. So we see that across a lot of the United Ways is working to use ALICE as the cutoff for social services within communities. So working with different nonprofits to help do that has been a big thing. It also helped us launch our Caregivers Initiative because what we saw was a lot of people incurring extra costs in their community because they're caregivers. So that's those family caregivers, people that are caring for a loved one, not being paid for it. So we started caregiver coalitions across Northern New Jersey as a way to do that and provide those resources. It also spurred our education initiatives. We do a lot of policy advocacy work about getting additional resources for childcare, because that's the most expensive line item. It's more expensive for most families than their housing. So really trying to advocate for one success with additional vouchers for early childcare education that we helped do this year. And we see different groups using this for a lot of different ways, but usually it's saying what are those main issues related to the budget in their community, and then creating programming to kind of support and surround that as well. So it really varies from place to place because the ALICE data varies so much from place to place. So what I would like to know from you, if you want to speak up or add in their comment, and I can read them, it's up to you if you want to unmute, is how can ALICE inform action in your area of interest? So has anything has sparked any thoughts in you? How could this be applied? And what else do you need to know in order to take action for ALICE in your communities? Any thoughts about how it could be used or applied? Or just general questions if there's more things you want to throw out there before we wrap up.
Yeah, you can either speak up and unmute your microphone, or you can put it in the chat. It doesn't matter.
This is Dominica. I just have one more question. Just wondering how you're working with other nonprofits or organizations to help bring this data forward. So a long time ago, when I used to work for the American Cancer Society, there was definitely, ALICE was not a part of any of the programming. And a lot of the need was exactly to this population. A lot of the calls we'd get in patient and family services was to this population. So just wondering how you're collaborating with other organizations to really promote this more.
Yeah, so it really, kind of depends on the area of interest, but one of the things that United for Alice does is, first of all, provide kind of education and training like this to bring more awareness to Alice. We spend a lot of time trying to do that with fellow nonprofits and also policymakers. So we do have folks that spend kind of a lot of time in the State House as well, trying to bring Alice to attention of others. We have in each state that we work in, so not just New Jersey, but the other 20 states that we work in, we have a research advisory committee, which are a bunch of different folks across research, nonprofits, business, a lot of different sectors who actually vet the data and help us design our methodology. And those are a lot of times the thought leaders and communities that we're helping with. Ooh, somebody's phone is really loud. Oh gosh. So I think a lot of it is the first step is that awareness and getting it out there. But we've also had a lot of people approach us to kind of tailor and understand the data specific to their areas. So that includes nonprofits like, Cancer Association and different folks reaching out to, first of all, get a training on the data, but then also we look at their specific areas that they serve, and we can look at those indicators like cancer rates related to Alice to help them make the case for it. So there's always people that we'd love to reach out and talk to, and I think it's just a matter of having those conversations. So this is a great start too. So now you all are hopefully ambassadors for Alice to help spread the word. But we're always willing to do additional trainings and additional kind of brainstorming about how to apply it within a specific agency. And there was a comment here too that it's great to consider those who are working but still struggling. It counters the argument that people are not willing to work for a better life. Yeah, absolutely. This is so common that we hear, first of all, people who are Alice, and it might be some of you in this webinar. Almost always when we're talking to people, there are people that this resonates with. They're like, yes, I am working, I am trying, but I had this huge medical bill and now I'm back to where I started. So first of all, I think it really helps people, validate people that, yeah, I do have this need, I am Alice, but that doesn't mean anything negative about me. It means I'm a hard worker. And we see that come up a lot, and it kind of changes that conversation. So when you stop thinking about these stereotypes and start thinking about the reality of people in your community, or making some realizations about your own life and what you've gone through, it can be validating, but also changes the conversation. So I appreciate you sharing that as well. We had another question too. How do you think the new minimum wage of $15 an hour will affect New Jersey? This is a complicated one. We, in general, United for Alice tries to be nonpartisan as much as possible. And, we like to help people come to their own conclusions about solutions without pushing too hard. But personally, I would say I think it's definitely a start, and it's definitely playing catch up to something that should have been happening for a long time. We see that gap between cost of living and wages just getting wider and wider and wider and wider over time. And even if we were just to be totally, honest and actually be paying a living wage, it would probably be even a little more than 15. So there is definitely, I think, a need to think really hard about our wages. But it also means we have to think hard about the programs that we provide people, especially different social services and things through the government, because sometimes you hit this, what we call a cliff effect, where people just make just a little bit more than a minimum wage requirement, for example, for public housing. And suddenly, even though they're not actually really having more spending power, suddenly they're not eligible for something that they needed. So a couple dollars more of a wage could have a negative impact on having housing, but the actual loss of housing is way more expensive than those minimum wages. So it has to be understood as part of a larger picture. And I think using Alice for eligibility versus the federal poverty level is a start for that. I think having more nuanced approaches to, and not these kind of black and white cutoffs for social programs is going to be really huge, but I think wages have to increase with cost of living at some point, but we need to be willing to work through the larger questions that come along with that too. So yeah, that's a big thing. We do, in terms of advocating for specific policy changes, there's a question here, would we advocate for universal pre-K, or would you stay out of politics completely? We do often take on specific advocacy initiatives as the United Way of Northern New Jersey. It's a little different than what we talk about as United for Alice, because United for Alice, again, is a partnership that involves 20 different states, including states like Texas, Arkansas, and then New York, New Jersey. So you see political divides in terms of who our partners are, which is fantastic because the discussions are really robust. But yes, the United Way of Northern New Jersey does do some direct policy advocacy work. We have a team that works on that. So if you're interested in learning more about that or would like to get involved, let me know. But in terms of United for Alice, we try to, at least in our reports, be really straightforward to the facts and provide some ideas about things that are being tried, but not provide direct policy direction so that we can make sure we keep everybody in the conversation. Other questions? These are great questions, by the way. Any ideas? I just want to end it there. If there's anybody who has something they're like, I want to try this now, or I'm going to bring this up at my meeting with X. I'm always curious to see how people might use it if possible.
Speak now or hold your peace.
I don't know.
Well, all right. Well, I think we can wrap it up if that's okay. So just as a last note, everyone will be receiving an evaluation that'll be sent out to your emails shortly. If you're an NJ SOPI member and you want CHES credits, don't forget to put in your name and CHES certification number at the bottom of the survey, because that's important, otherwise you can't get the credits. And the next webinar is going to be on May 9th at 1 p.m. and we're going to be having Tracy Storms-Mizuko from Centers for Prevention, and she's going to be talking about tobacco and e-cigarettes. It's called Don't Get Vaped In. So be on the lookout for more information regarding that and future webinars and trainings on the NJ SOPI web forum and forum updates that you would get your email if you're signed up for them. All right, everyone have a good day.
Thanks so much. And my information is up on the screen too if you wanted to reach out and ask any additional questions or follow up or any connections. And I also know Tracy, she's great. So that will be a great next webinar. So thanks everybody so much for your time, for listening, and for your interest in Alice. I hope it continues. Thanks.
Thank you.
Ashley.
Thank you, Ashley.
Thank you all.